The next thing that you should be noticing as you're looking at Friedman's argument would be this little thing right here in the margin. And this is information about Friedman herself. It is her credentials, right? It tells you where she works, that she's an associate professor of surgery. And if you look, it says Section of Organ Transplantation and Immunology, Yale University School of Medicine. Okay, so it works in not just the medical field. She's not just a surgeon, but it's in the organ transplantation and immunology. So she specializes in the area about, like, in the topic that the paper is, that the argument is. So she has wonderful credentials here, right? She's providing her credentials. She also works at a highly regarded school, and she's not just a surgeon. She also is an associate professor of surgery, which means that she teaches other people how to be surgeons. So her credentials are excellent. So this would be an example of ethos, because she is providing her credentials to her audience before they actually read the article, right? Because if you think about it, this is in the left margin. Our eyes, when we read left to right. So before we even start this paragraph here, the first paragraph, our eye is going to catch on this. So before we even start reading her audience starts reading her article, her argument, they are going to see her credentials. Why is that important? That's what you need to be writing about. You need to identify that this is an example of ethos, right? That it has to do with her credentials, and that it's establishing herself as an expert. Why is that important? How does that make her audience trust her? Think about her specific audience, right? The medical field. People in the medical field. So just saying that she's a surgeon or a doctor might have been enough for your average person, but someone in the medical field is going to want to know that she specializes in this particular area. See, and so that's going to help them trust her as an expert. And then why is that important? If they trust her, they're more likely to accept what it is she's saying as a valid argument. That's the analysis, all of those steps, going through every one of those steps, not just identifying, right, the use of ethos, but how and why she uses it, how it affects her audience, and how does that effect on her audience help Friedman persuade them to be advocates or to support this. Payment for living organ donation should be legalized. So this is something, her credentials here on the side, this is something that you should be talking about in your paper under ethos. Now, as I go through all of these different pieces in the argument, I'm not going to give you the full analysis of every single one of them. That part of that is your job to go through that analysis, but I will make sure I identify them and give some explanation of them to help you. Now, in the first paragraph, and actually it's the first whole page of this article, right? This whole first page is Friedman establishing the problem in her claim of policy. One of the things you may want to talk about in your paper is the fact that Friedman wrote this as a claim of policy, right? Because she wants a policy to be enacted, right? Something to happen. So it is a claim of policy, and in a claim of policy, if you go back to the information about it in our class site, then you'll find that it says that there are two pieces to a claim of policy. The first one is establishing the problem, right, to prove that a problem exists and that it needs a solution. And the second half of it, or the second part of it, is that you provide that solution. And you have to prove, argue, convince your audience that your solution will not only work, that it's a valid solution, but it's the best solution, right? So Friedman does this. And she does it in the proper order. First, she gives the problem, right? She convinces her audience that a problem exists. Her whole first page convinces her audience that the problem exists. The rest of her paper, the rest of the argument of the article, is talking about the solution. So, problem solution. If you're going to talk about this as a claim of policy, that should be the first thing in your paper. Because it would help the rest of, like, everything else you talk about would make more sense after you talk about this. And you have to break it up really into problem and solution. If you look at the template for this paper, it's not, you don't have to use that template, but it's, just a suggestion. It gives you an example. That's how it is, right? Claim of policy as a level 1 heading, and then broken up problem solution as level 2 headings. So How does she establish her problem? What is the problem? Well, obviously the problem is that the system we have in place right now isn't working, right? Because she's saying that payment for living organ donation should be legalized. The problem is since it's not legalized, since we don't have this in our system right now, our system is not working. So when you take a look at this, she breaks it into sort of three pieces, right? The first thing she tells her audience as far as establishing the problem is that the first sentence, the demand for life-saving organ transplantation has so outpaced supply that waiting patients and transplant teams are desperate. All right. So what she's saying is that more people need organs, right? There are more recipients than there are donors. You know, people waiting for these organs. We don't have enough organs for the people who need them. That's a huge problem, right? And she's saying that, so basically that the demand has outpaced the supply. Additionally, she says the organ shortage is getting progressively severe. Progressively severe. So that means it's continually getting worse. It's not just bad and it's going to stay bad. As time goes on, it is getting worse and worse and worse. That's what the progressively severe means. So she's saying not only is it bad right now, it's just going to keep getting worse. So here is this problem that we need a solution to that really helps to spur on her audience saying, we need to find a solution because it's just getting worse. Okay, and then she talks about some of the pieces of this problem, right? One of the problems, or one of the parts of the problem, is right here. Because payment for organs is illegal in most countries, people may travel to the donor's homeland for the transplantation. And then she goes on to talk about the exploitation of these paid donors, right? This possible exploitation. And so here is another part of the problem, right? Since they can't get an organ through legal means in our own countries, right? Then they're going to go to countries where they can purchase one. And then she's saying the problem is that these countries where you can purchase them, that it's not very well regulated, right? They don't know how legitimate and ethically consistent things are. They don't know if these people who are donating the organs are getting paid for their organs are getting a fair price for them. Of course, what kind of medical treatment they're getting. Are they getting good medical treatment or not, right? So there's all of these issues that go along with going to these other countries where it's not regulated. It talks about adverse outcomes that they might experience. So that's another part of the problem. And then the third part of the problem that she talks about is that it is unfair to the donors. The current system we are in right now is unfair to the organ donors because everybody else benefits but them, right? She talks about how medical doctors and the whole medical community basically benefits. She talks about how the families of the recipient and the families of the recipient benefit, how taxpayers in general benefit, but the person who doesn't benefit, other than that psychological benefit of knowing they did something good, is the donor. In fact, the donor, on top of not getting any benefit out of it, may have to pay costs of travel to the site of transplantation and get no compensation for lost wages. So on top of the fact that they're the one giving the organ, right? They're donating that organ. All of these other people are benefiting, right? The medical community, the recipient's families, but who's not benefiting? The donor, the one who makes all of that benefit here and benefit here possible. On top of them not benefiting, they may actually have to pay cost and lose wages if, because they're either have to use vacation days up, they don't have any, if they're going to be gone and out for a long time, they may actually lose pay. So they're actually, it's a detriment to them financially. And so she's saying this is not fair, right? This is not equitable. And so she's saying this is another problem, that it's not fair to these people. And if it were fair to these people, then maybe there would be more organs, then we wouldn't have the shortage, and then they wouldn't have to go to these other countries where they may not get good care. So she's establishing the problem on multiple levels. Okay, so that's what you need to talk about when you talk about the problem. When you talk about the solution in her claim of policy, there's two things you need to talk about. One of them is this here, the financial reward for other uses of the human body. And what she does is she establishes and we're also going to talk about this whole thing in logos, but she establishes that, look, we already pay for donations and or use of the human body. So my solution is a valid, acceptable, ethical solution because we already do something like this. We're just going to expand this idea into paying for the organ donations. So this is part of her solution because she has to first make sure that her audience agrees with that ethical principle, right? It's sort of like a warrant. If you remember going through the warrant lesson, and they talked about warrants. So here she's saying, okay, I need everybody to be able to agree that it is ethically acceptable. And this is how she is going to try to convince them of that. Then she says, okay, and then she gives some examples or some information about how it's going to work. She's going to answer her audience's questions. She knows her audience is going to have questions. Well, what about this? Well, what about this? What about if it's a family member, even though they don't live in the same country? What about who's going to regulate it? How are we going to pay for it? Is everybody going to get paid the same thing? There's going to be all these questions, right? So Friedman tries to answer the questions here as best she can. She can't give specific answers about everything because she's not the person who's actually going to draft the legislation, right? Not like she drafted a bill that she wants passed. She's just saying this is the direction we need to move in. Here are some protocols that could be put in place in order to protect the donors, etc. So she's trying to answer any questions through here. So that's how you would have the claim of policy, problem, and solution.